So are seed oils harmful? It's a very common question that I get. I would say the majority of evidence would suggest that yes, they are harmful. Now, it's not perfect, but let's kind of go over sort of the one group, one team sort of that's pro seed oils, and sort of let's talk about the evidence where people are against seed oils. Ultimately, we should just be looking at the randomized controlled studies on hard endpoints like coronary heart disease events, cardiac deaths, all-cause mortality, which is the most unassailable endpoint. Most of the studies show harms with seed oils than not. In fact, there's really only one study that actually shows potential benefit with seed oils, and that is the LA veteran study. But there were so many problems with that study that we should completely scrap it. So for one, it wasn't an inpatient setting. So people could leave the veteran home whenever they wanted to and consume foods outside of the home. So we really don't know exactly what these people consumed. They could also become unblinded because the taste of the seed oils in the milk and in the ice cream was unpleasant. And because of that, there were more people that actually dropped off in the LA veteran study on the seed oil group versus in the control. So if you follow up less people, you're going to have less heart attacks just because there's less people to follow up on. And so there was a 20% dropout rate in the seed oil group in the LA veteran study, only 8% in the control. So that completely biases the results in favor of seed oils. And that's probably why there was a quote unquote benefit. Now, this benefit wasn't even on the primary endpoint. It was an exploratory secondary endpoint, which cannot prove causation. So the primary endpoint didn't find a significant benefit with seed oils anyway. So anyone that points to a possible benefit with seed oils from the LA veteran study, they're looking at a secondary exploratory endpoint, which can never be used to determine causation. The primary endpoint did not show benefit with the consumption of seed oils. Now, at baseline, the omega-6 group had less patients that had a previous heart attack and possible or probable heart attack based on EKG. So this was a lower risk group to begin with. They had less heavy smokers, less overall smokers as well compared to control. That could have contributed to the difference. What also could contribute to the difference of the benefit in the secondary endpoint was that the control group, the group eating more animal fats, was distinctively deficient in vitamin E. And we know that vitamin E in randomized controlled trials has been shown to lower heart attack risk in many studies. And so that could have driven some of the potential benefit, was that the group eating more animal fats was distinctively deficient in vitamin E. They were also deficient in ALA, so they only consumed maybe 100 milligrams of alpha-linolenic acid, whereas the other group had at least 700 milligrams. So the difference in omega-3s too could have driven some of that benefit. So anybody trying to use LA veterans has not read the study, has not looked at the flaws. It was only in starting out in 800 patients too, so it was a small clinical study, but it did go out up to about 8 years. Now, one actual potential harm that was shown was an increase in cancer. It wasn't statistically significant, but that was because 2 patients in the control group had multiple lesions of skin cancer. And so that kind of drove the skin overall cancer to not be significantly different. But if you removed the skin cancers, which by the way, none of them were fatal, there was a statistically significant increase in cancer in those get on the seed oil group. So that is a red flag. So if you're going to try to use LA veterans as potential benefits on a secondary exploratory analysis, then you have to also explain why there was a significant increase in cancers when you removed the 2 controls that had multiple lesions of like basal cell carcinoma and squamous cell carcinoma. So you can't just like ignore the cancer potential. Now, some people will say, well, that was only in people that were not very adherent. Only 49% of the people in the seed oil group were adherent at all anyway. So trying to explain it away that most of those cancers were in low adherent patients, the total population eating the seed oil group was very non-adherent anyway. So regardless, it wasn't an inpatient like hospital setting where they controlled all the foods, whereas Minnesota coronary experiment was. So you have one study that is super flawed that cannot show any type of real benefit from all the flaws and from it being an exploratory endpoint, and actually you have to balance the risk of cancer. But then you have 6 other studies showing harm of seed oils, like Sydney Diet Heart, Minnesota Coronary Experiment /Survey, some papers call it Minnesota Coronary Survey, Rose Corn. You also had the margarine study. There was also the Norwegian vegetable oil study, and even Leon Diet Heart study also suggests that omega-6 can potentially be harmful. So Sydney Diet Heart, people try to explain that away and say, well, the group given the linoleic acid enriched margarine, there was also some trans fats in there. But that that is a really bad excuse because the control group, the group eating more animal fats, were told to consume the commonly available margarines of the day, which had much more trans fat than the miracle margarine in Sydney Diet Heart Study. So the Sydney Diet Heart Study, the miracle margarine may have had 15% trans fats. The margarines that the control group were eating, the animal fat group was eating, would have been 20 to 30% trans fats. So they would have gotten more trans fats from the margarines that they were eating, the common day available margarines, versus the linoleic acid enhanced margarine. They would have had up to twice as many trans fats. So that doesn't explain it. Also, the LA veteran study, going back to that too, the animal group actually consumed more trans fats, like over 2 grams of trans fats, where it stated specifically restricted in the LA veteran study. So Sydney Diet Heart trying to say that, well, they also consumed trans fats. The control group would have had more trans fats. So that doesn't explain away the harms, the increase in all-cause mortality and coronary heart disease events in the Sydney Diet Heart Study. And same thing with Minnesota coronary experiment, where there was an increase in coronary heart disease events, especially in women consuming more seed oils. Because, again, the margarines that were commonly available that the animal fats group would have consumed would have had more trans fats than the linoleic acid enriched margarines. So trans fats, you can't just say, well, they also got trans fats. Well, so did the control group at a higher amount. So that does not explain away the harms. Again, so Sydney Diet Heart Study, increased harms with seed oils versus animal fats, and same thing with Minnesota coronary experiment. Rose corn also showed increased death with seed oils versus olive oil in control group. So those are the 3 main studies that most people know. But the margarine study also showed that there were 7 cardiac events in the linoleic acid enriched margarine group versus only 1 in the alpha linolenic acid group. Leon Diet Heart, specifically reducing omega-6 from 5.3% total energy down to like 3.6% total energy, significantly reduced the primary endpoint by 70%. Now, some people will say, well, it was a multi-intervention study. Yes, it was. But if you actually look at the decreases in, let's say, luncheon meat or the increases in vegetables, if you look at any of the changes in foods, they were all less than 2 ounces different compared to the control. So basically, it was like no real difference in what these people were consuming in regards to legumes, in regards to luncheon meat, in regards to vegetables and fruits. They were all less than a 2 ounce difference, and many times only like 10 gram difference in comparison. What was the big change was the drop in linoleic acid energy consumption, and getting linoleic acid below 4% total energy significantly reduced primary endpoint by 70%. The Norwegian vegetable oil study as well, it compared linseed oil, which is flaxseed oil, to corn oil. And there were more. There was like 12%. There was more deaths and more basically coronary events in the corn oil group than the linseed group. So again, 6 studies. Anti-Coronary Club also shows harms, but that wasn't a randomized controlled trial. But you have really 6 studies that really show potential harm with seed oils compared to the 1 very flawed LA veterans. So in my opinion, the weight of the evidence in regards to randomized controlled trials and hard endpoints suggests seed oils are harmful. Even if you were to believe that none of this was true, it's a huge question mark. We never used to consume seed oils until about 100 years ago. So why would you not cook with like extra virgin olive oil or like grass-fed animal fats?